Thanks very much for joining us. We have 5,165 cases of coronavirus in Victoria. That is 428 new cases since we last updated you. 57 of those are connected to known outbreaks, 1 from quarantine, and 370 of those cases are under investigation by our public health team. I'm very sad to have to inform you that there have been 3 further deaths, bringing the total number of fatalities, total number of lives lost to this virus to 32 since yesterday. So the details of those individuals: there's 1 gentleman in his 80s, 1 gentleman in his 70s, and a woman in her 80s. I can offer no further information about those 3 tragedies, but we send our best wishes and our thoughts and prayers to their families. This will be a particularly challenging and very, very sad time for them. If any further information can be provided, then that would be a feature, I think, of the Chief Health Officer's media release later in the day. 122 Victorians are in hospital, 31 of those are receiving intensive care. Yesterday we had 24,409 tests, which is, again, a very impressive number. Very, very grateful to every Victorian who's coming forward, even with the mildest of symptoms, to get tested. As I've said so many times, but I'll keep on saying it because it is so important. That gives us the data, the certainty about where this virus is presenting, how it's moving through the community, and with those results we can trace people, make sure that people are isolating at home, make sure that people are limiting their contact with others, and also through those positive results and networks of close contacts, we can potentially provide care and medical intervention earlier than would otherwise be the case, and that can be the difference in terms of just how serious the disease presents and just how serious the health consequences are for those involved. That brings our total testing to 1,250,408 tests since January 1. Again, one of the highest testing rates anywhere in the world. I want to appeal to every single Victorian. If you have symptoms, even mild symptoms, please come forward and get tested. It's a relatively quick process. It's a simple thing in many respects, but it makes a massive difference to our collective fight against this enemy, against this virus. That intelligence, that information, that data allows us to really respond the only way we can, and that is to isolate people who have the virus, limit the number of people that they come into contact with, and therefore limit the spread of this virus. I'm deeply grateful to everyone who has been tested, and I would urge Victorians to come forward, even if you have the mildest symptoms, in order to get a test. Just in general terms, before I ask Brett to add to these comments, we are going to increase the total number of testing sites across regional Victoria. And in fact, Jenny can take us through that before Brett talks about the epidemiology of the day. There will be a number of additional test sites stood up. There's more than 50 of those already operating in regional Victoria. We do continue to see low numbers, albeit some additional cases in regional Victoria, around 5 today, further details of which will be forthcoming in that Cho media release later in the day. But they are relatively low numbers in the scheme of things, and we're comforted by that. These things can change rapidly though, and that's why additional test sites and expanded test sites are critically important. We're also standing up dedicated regional public health teams, so local squads, who really can bring that intensive intervention to even the smallest number of cases, to really sit on those positive cases to make sure that they get the best public health response, that we catch them early and that we can limit their contact with other people. And I'm very grateful to those who have tested positive in regional Victoria for following those detailed quarantine rules, making sure that they stay at home, making sure that they're not spreading the virus through anything that they do. That's critically important, and again, a really significant contribution that those individuals, albeit small numbers, are making to keeping those numbers very small right across regional Victoria. That ring around Melbourne and Mitchell Shire is working in terms of reducing the spread of this virus into regional Victoria, but it can change. It can change if people don't follow the rules. It can change if people have symptoms and go about their business as if they didn't. It can certainly change if people pretend this is over because they really want it to be. That's not the situation we face. That's not the reality that we have to confront. Jenny will speak a bit more about some of those dedicated teams and the additional testing capacity in regional Victoria so we can try and stay a step ahead of the virus as it presents outside metropolitan Melbourne. Inside metropolitan Melbourne, can I again thank every single person in metropolitan Melbourne and Mitchell Shire who's doing the right thing, making great sacrifices, staying at home, limiting their activity, following the rules. They are common sense rules, and that's the guiding principle. If you've got to ask yourself and give a whole lot of thought to whether what you're planning to do is within the rules or against the rules, the chances are it is against the rules. Common sense is what really should guide everybody. These are sacrifices. I know that no one is enjoying being in a 6-week lockdown. Those stay-at-home orders are deeply frustrating. But at the same time, they are the only tool that we have. We don't want to extend this any longer than the 6 weeks. We don't want to have to put in additional rules. And that's why we're so grateful to those who are doing the right thing. And we've got a message, a very clear message, to those who are not. Victoria Police are out there. There's been some further advice provided overnight that is essentially to assist police in doing their important work. Can I just cite one example? We saw last night some coverage of a couple of people who had travelled from Coburg to, I think, Rye on the Mornington Peninsula. That is a 200-kilometre round trip. That is not daily exercise. That is a day trip. And day trips are not on. There's nothing with that, nothing about that is compatible with staying at home. If you can walk, if you want to go for a walk, then you can go for a walk close to home. That just makes sense. Otherwise, if you're travelling literally 200-kilometre round trips, will do nothing but spread this virus. I know it's inconvenient. I'm sure people would love to go to perhaps more scenic locations, perhaps locations that they spend time at normally, but this is not a normal winter. This is not, as we approach this weekend, it is not a normal weekend. These numbers are very challenging. We've always said it would get worse before it got better. Let's not any of us contribute to the fact that we have got significant virus and it is spreading across the Victorian community. Let's not contribute to that. Let's do everything we can to pull that up. Ultimately, good judgment, common sense. You know, if I want to go for a walk, then I'll go for a walk in Mulgrave, where I live. I will not go to the Tan. I will certainly not be driving 50 kilometres away or 100 kilometres away from my home to go and do something that I'd very much like to do. That's not compatible with stopping the spread of this virus. There are clear rules, but even then, I would just say to those people who are spending inordinate amounts of time trying to find ways around these rules, that's not where we're at. That's not helpful. That is not going to do anything to pull this virus up. We just have to use common sense for ourselves, for our family, for our community, for every single Victorian family. And if that's not enough of a motivation, well then, to simply get out of these restrictions quicker than would otherwise be the case, let's all follow the rules and exercise good, sound, common sense, good judgment over these next 5 weeks or so. This is simple in many respects. They're small things for many people, but they do make a really big difference in the number of people who will be infected, the length of time that we will be locked down, and the likelihood or otherwise of having to add to these rules with further restrictions, further frustration, further difficulties for so many people. So please, I don't want to take away from the fact that so many people are doing the right thing, and I thank them. I thank them really clearly. We are so grateful to them. That is the vast majority, but a day trip is not the same as daily exercise. It's a very different thing, and it is not on. So please use good judgment. Please follow the rules. That's how we'll get out of this home isolation quicker than would otherwise be the case. That's how we'll limit the spread of the virus. That's how we'll keep people well, and it is how we'll get to the other side of this. I might just ask Jenny quickly to go through those regional test sites and regional dedicated public health teams, and then Brett can take us through outbreaks and all the usual information that you seek from him, and then we can take any questions you have.
you, Premier, and good morning. In recent weeks, we have been seeing a steady increase in coronavirus cases across Victoria, but concentrated largely in metropolitan Melbourne. And today's numbers just demonstrate the gravity of the situation. 122 people now in hospital, 13 more than yesterday, and more people again in our intensive care units. So I do want to impress upon all Victorians the seriousness of the situation and the need to follow the rules and exercise common sense. We're keeping a very close eye on regional Victoria, and whilst the numbers in regional communities have been lower, we've had about 42 cases since the 1st of July, we're keeping a very close eye and monitoring the data on a daily basis, and it's very important that regional Victorians do not become complacent. This is why we are stepping up our ability to identify and respond to cases in regional communities. We're going to do that in a number of ways. Firstly, we'll be stepping up additional testing capacity. We have 160 different testing sites across Victoria at the moment, of which 60 of those are in regional communities, and we're looking to establish new sites or expand existing ones to make it easier for regional Victorians to get tested. So those new and expanded sites will be in a number of communities across Victoria, in Campaspe, at Echuca Regional Health, at Bass Coast Health, that is at Wonthaggi Hospital, in Greater Bendigo at La Trobe University Rural Health School, in Greater Shepparton, based at Goulburn Valley Health, in Kuirup, based at the Kuirup Community Centre, and also in Mildura, providing a drive-through facility there. And we'll be providing and establishing further testing sites right across Victoria, including in regional communities, in coming days and weeks. We want to encourage regional Victorians to not be complacent, to do common sense things like staying home as much as possible, but particularly if they are sick, it is vital that they stay home and they present to be tested even if they have mild symptoms. We have had some cases of people who might be commuting to Melbourne, going back to regional communities, and therefore infecting their family members. So it's important that people are aware that there are risks at the moment in regional communities, and that they need to take every step possible to keep themselves, their families and their loved ones and their entire community safe as well. We're also stepping up our ability to trace regional cases. We're establishing public health teams in regional Victoria for the very first time. We are facing a once-in-a-100-year event here with this pandemic, and so now we are going to be establishing 5 public health teams based at regional health services to enable local people, local clinicians based in those health services to do the contact tracing and identify cases in the local communities that they know best. We're starting with Barwon Health. That team of 10 clinicians will be on the job from this week, and then we will be establishing further sites in Bendigo, in Ballarat, in the La Trobe Valley, and also in Shepparton. So all of those communities, and potentially more if there is a need to do so, will have locally based public health teams on the job doing that disease detective work and making sure their communities can stay safe. So I just want to conclude my remarks in saying that we have seen great tragedy this week. We've had 3 elderly Victorians lose their life sadly in the past 24 hours, and I want to express my condolences to their families. And we've had other families who've experienced tragedy in recent days as well. This is a very serious situation. We are in the fight for our lives. And I want to impress on all Victorians the need to be vigilant, to limit their movements. They do not need to be exercising outside of their local area. They do not need to be going to the shops every day. Limit your movements, follow the rules, and we will get through this. We are all in this together, and it's important that we all take this situation very, very seriously. Thank you.
Just before we ask Brett to go through outbreaks and other things, I did neglect to mention one further development in regional Victoria. We are now requesting of all regional Victorians if you are out and about for a lawful purpose, there are different rules in regional Victoria, and we're very pleased to be able to say that. But there are still rules in terms of gatherings and things of that nature. And of course, hand hygiene, cough etiquette, never going out if you're sick, getting tested if you've got even the mildest of symptoms are chief among them. But as a precautionary measure, we are now requesting of all regional Victorians, if you are out and about and you don't believe you'll be able to maintain that 1.5 metre social distance, so if you're in an Uber or a taxi or public transport or any other setting at the shops, buying the things you need to buy when you need to buy them, if you are out and about in regional Victoria and you don't think you can maintain that social distance, then we are requesting of you that you wear a mask. That is a small thing, but it can make a really big difference in stopping the spread of this virus and keeping those low numbers in regional Victoria very low, so that we don't have to be changing the settings and the rules for regional areas of our state. That mask can be homemade, that mask can be one you've bought, that mask can take the form of simply wearing a scarf. All of these things, they never eliminate risk, but they reduce risk, and that's something that all of us should be completely focused on. The Chief Health Officer might want to speak to that in more detail, but I did neglect to mention that off the top. But now I'll ask Brett to take you through the data for the day, and then we can take any questions you have.
Thanks, Premier. Certainly 428 cases, new cases, is both disappointing and concerning. We have not turned the corner here. Worse than that, 428 cases does not just represent that we've got increasing numbers day on day. There will be dozens of individuals who will require hospitalisation out of these 428 people. Tragically, there will be several who will require intensive care support, and a number of people will die. And whenever we have a day with these numbers, that is the case. So it has to turn around. I have talked for some days about a hope that numbers stabilise, but also said there is no guarantee about that. It does reflect behaviours and mobility from 10 or more days ago. And so, of course, there's a hope that these numbers stabilise in the coming days towards the end of this week. That's my hope, but no one is being complacent here, and we are all thinking about the additional measures that might be required if it doesn't turn around. We are not just banking on the idea that if we wait long enough, that number will stabilise and go down. So we have to bear in mind any additional measures that are important to help control the numbers. There are a number of outbreaks that are ongoing. New cases linked to those outbreaks are partly responsible for driving up the numbers. When you've got so many outbreaks that help amplify transmission, they obviously contribute to the increase in numbers. A few updates: 160 cases now linked to Al Taqwa College, 51 cases to Somerville Retail Services in Tottenham, 38 cases at Menarok in Essendon, 36 cases at Estia in Ardea, 32 cases to JBS Abattoir in Brooklyn. There's also some stabilisation in other settings. 19 cases in Northern Hospital, no change since yesterday. 16 cases at Brunswick Private Hospital, no change since yesterday. And the 23 cases at Glendale Aged Care in Werribee hasn't changed since yesterday. But there are new aged care facilities with cases reported. That includes Aurum Aged Care in Plenty, and then single cases linked to Regis in Brighton, Grace Villa in Greensborough, Bapt Care Wyndham Lodge in Werribee, and Bupa Aged Care in Sunshine. As I said, these numbers represent a daily tragedy. There have been 3 new cases since yesterday, and with over 400 cases today, we know that that will represent people who become very unwell, some people, of course, with mild illness, but a number of people who become unwell and actually have chronic symptoms after that. Recent evidence suggests that people have symptoms for weeks, 2 months after recovering. So this is not even an illness where You get over it after a couple of weeks and you get back to a normal state of health. For many, many people, this represents a disability that they carry with their breathing or with their general health for some time to come. And we are not far enough into this pandemic to know what the long-term consequences might be. And there may well be people who really carry this disability or this chronic condition for years to come. I hope that is not the case, but it is obviously concerning that people who've required hospitalisation, people who have severe illness, really do not recover for some weeks afterwards.
Is it time to stop all visitors to aged care centres and to actually ban, mandate staff can't move to these centres?
What we've seen from the aged care outbreaks is that it's really staff who are becoming unwell and inadvertently bringing virus into those aged care facilities. Visitors are checked very closely. There's been a significant limitation on visitors, but we're not seeing that visitors have introduced it into those facilities. There is an important element to the health of residents in seeing their loved ones and their carers. Some individuals will die when they don't see their loved ones and carers, and so there's a balance to be struck there. But I know that a lot of aged care facilities have really significantly reduced visitation. I don't think it should be a ban. I think it needs to be considered on a case-by-case basis.
Were any of today's deaths linked to those aged care facilities? Because with those clusters, are you now reporting?
There's one individual who's linked to an aged care facility from today's deaths, yes. Menarok.
So what's the total number of deaths now in the
I don't know, sorry, Andrew.
So sorry, Brett, was that how many cases, or three of those cases did you linked to mental health?
No, just one.
Just one, sorry. And just further to that, you talked about the reproduction rate yesterday. Do you have that? What's the current reproduction rate?
Look, there are different methods in calculating the effective reproduction number. It's very close to one, if not below one. It kind of we get a range. So there's a probability that it's below one. There's a probability that it's above one. It seems to be sitting at one from the modelling that's been done. That's reassuring. But we also have to go on the numbers we see every day. We also have to take that precautionary principle and work on the basis that we can't just sit back and expect numbers to go down because modelling tells us so. We have to accept that all models are imperfect. They've been very good at predicting the numbers week by week in Victoria to date. But we have to accept that if we see ongoing numbers, even if the modelling is telling us it should go down, we have to respond to the reality on the ground.
So when we're seeing such big numbers day by day, even if we don't go over to the stage 4 restrictions, do you think it's now increasingly likely the 6-week lockdown is going to become longer than that?
It's really hard to say how long a lockdown might be required. If people are really following the restrictions and doing the key things that we're asking of them, we've seen these numbers drive down very quickly. Through the first wave, the effective reproduction number got to 0.5, and so really cases were halving every cycle, every generation. We can do that if people are really universally following the directions.
They're clearly not, though, are they? I mean,
Well,
we would see improvements by now.
It is early days, and we can still see, as numbers decrease, our ability to find individuals and to follow their close contacts gets greater and greater, and we can reduce those numbers on the downside much faster because it becomes more in our control when the numbers are less. But it has been a slower process.
Sorry, you said you'd started thinking about the additional measures that might be required if we don't see a turnaround. Are you able to talk us through what your thinking is there and I guess what the threshold is that you're going to reach where you decide those additional measures are required?
Everything's on the table. There are lots and lots of measures that we need to bear in mind, and we shouldn't discount anything. We do need to follow the epidemiology and understand where transmission is occurring. We know that essential work is driving some of it with our outbreaks in aged care and in healthcare, and so there's absolutely a focus on PPE and awareness of symptoms in aged care and healthcare workers, and universal mask wearing is something we're absolutely advocating for in this space, but also the screening, the symptom awareness for everyone so that they are getting tested and isolating very early on. There might be other workplaces that we need to look at. There might be increased compliance measures that we need to look at, but we're not there yet in terms of defining and understanding exactly what might be required or if it's required yet.
Hospitalisation numbers keep rising and rising. What measures have been put in place for those doctors who are on the front line? Are they being put in alternative accommodation so they don't take this virus home? Not just doctors, but all healthcare workers. Is there enough capacity in that sort of protecting them?
Yeah, I might get the minute to speak to the Hospital for Heroes program.
Thank you. So we have committed to a Hotels for Heroes program, which provides the ability for healthcare workers to be provided with accommodation to keep them safe from their families, and that is if they are diagnosed or close contacts, but also if there are particular circumstances unique to that family. So, for example, there might be a family member who might be immunocompromised. We assess these matters and we do provide those healthcare workers with that accommodation to respond to these issues.
Stepped up in the last couple of days,
We have had quite a few healthcare workers that we are providing this program to, and we're actually now looking at making that available to aged care workers in the private aged care sector as well. We know that they are particularly experiencing challenges at the moment, and can I just say in relation to that sector, I've been having lots of conversations with Minister Hunt and Minister Colback around the particular risks involved with private aged care in Victoria. I'm grateful for the fact that they've agreed to provide masks to the sector, given it is a federally regulated, largely federally funded sector. And the conversations we've had have been around extending that to all nursing homes in Victoria, not just in Melbourne. And as well as looking at regular testing. Now, as a Victorian government, we did provide asymptomatic testing of aged care workers earlier in the year as part of our testing blitz. We provided that testing to about 5,000 aged care workers. That did identify a small number of workers through that process. And we're working with the Commonwealth around these issues, looking at stepping that testing up with their support and assistance so that happens on a more regular basis. There are some structural, issues that present some key risks in this sector, and that is, the mobility of the workforce moving across different facilities. We know that this is, a low-paid workforce that needs to make up shifts across many different nursing homes. And as they move around, it does present a risk to the residents in that in those facilities. So just in recent days, we've had aged care workers who've worked across a number of facilities that have led to an outbreak in 4 of those aged care homes by virtue of those workers moving across those different facilities. So these are discussions that we're having with the Commonwealth. It's important that the aged care sector look to limit, the movement of the workforce, but it's important, of course, that workers don't feel that they are financially penalised through that process and effectively losing shifts, but they are issues that the sector and the Commonwealth need to look at. But we're having lots of discussions with them around these issues. These have been constructive discussions, but we don't have the levers here. This is, as I said, a Commonwealth regulated sector, and it's important that that the sector understands the risks involved here if we've got workers moving across one facility. So, we are taking steps to support this sector at this time, support the workforce, and will involve all levels of government and the sector working together to address these particular risks.
Would you like to see the federal government and all the private operators compensate workers for those lost shifts so they do just stay on spot? Is that something you
Yeah, look, I think it's important that these conversations continue, that they work with... these are discussions that we're having around with healthcare sector unions, with the sector, with the Commonwealth around these issues. It's important that workers don't feel that they need to make a choice between putting food on the table or or staying home and recovering from coronavirus. That's, as a government, we have stepped up and have provided that $1,500 hardship payment that's available to casual aged care workers working in the private aged care sector. It's important that everyone is doing their part to keep these residents safe.
That $1,500 payment, is that only for workers who've been told that they have to isolate from the department? That's just not if you've got doctors, civils and you
Yeah.
need to go to work.
Yeah. So the $1,500 hardship payment that we've made available is for people who need to isolate at home because they've either tested positive or they are a close contact of someone who has been diagnosed with coronavirus. So that's available to people who don't have the ability to access leave entitlements. That would obviously apply to, casual workers who might be agency staff who don't have those type of leave entitlements. So, we are making that available to people who require that support, but these people can't access other forms of Commonwealth income support. So these are all issues that are part of our ongoing dialogue with the Commonwealth Government. This is a big challenge for Victoria at the moment. We're seeing lots and lots of outbreaks in aged care facilities. I'm very concerned as the Health Minister about those residents. We have stepped up and ensured that where residents do need clinical care and they've tested positive, they have in fact been moved to our hospitals, but we cannot have a situation where we have, all residents in private aged care facilities taking up hospital beds. It's got to be all the parties, all levels of government and the aged care sector stepping up and working to address the risks here.
Brett, when do you need to see a decline start to happen? You talk about lockdowns only being in place for 8 days. We talk about not enough time yet, but when is enough time to actually see something? People, every day when numbers come out, public are lock us down, scared. When is the time frame?
Certainly, we have an expectation that the things that we've put in place 2 weeks earlier should show up in the numbers. So when that 2-week period is completed, we would expect that to manifest in the numbers. So at the end of this week, we're getting very close to that. I think it's still a consideration every day, and we wouldn't wait for a 2-week period if we see concerning elements in any of the postcodes, any of the local government areas, or any of the kind of transmission networks that we're reviewing every day. So 2 weeks is a simple answer, but it's not to say that we would wait that long before making a decision.
Those hotspot postcodes are now being locked down over 2 weeks. Has the behaviour moderated? Have the cases in those hotspots moderated? It doesn't appear that it has.
They have and they haven't. So the mobility data suggests that it's changed very significantly across Metro Melbourne, including in the hotspot areas. So it's not as if that hasn't shifted. I've seen very significant shifts in the data for mobility in terms of the amount of time people are spending at home, how much traffic there is on the roads, and the general movement of people from Facebook and Google data that's publicly available. That said, not all postcodes have stabilised. We've seen some postcodes within the initial areas that have plateaued to some degree, but there are other postcodes within those same local government areas that continue to take off. And so it's not a uniform picture, and it might be that some of those other postcodes are yet to plateau, but it might be that they're not moving in that direction. And so again, we have to bear in mind that there's a precautionary principle to take. We wouldn't wait and wait and wait to see if that change occurs. We need to see what it's looking like on a daily basis.
Premier, on that point, would you not consider tougher, more policing of those areas where the data is showing that people can't listen?
Well, what I'd say, Rich, is that this is not like a tap where you just turn it off and you go from 400 cases to 0. What the 2 weeks that we've just experienced, and it's not 2 weeks of full lockdown across Melbourne, but it is about that in terms of those hotspot postcodes. What we might be seeing is the outcome of that is instead of getting 3,000 cases a day, we're getting these sorts of numbers. And it's always difficult to measure what isn't happening, of course, but we will look at the data. We've always been driven by the data and the science of this. And if if we're not seeing a stabilisation, or if we're not seeing a sense of control and a sense of any sense of the strategy is not delivering the outcome, or at least presenting a trajectory that we want to see, then of course, as Brett said, everything is on the table. The likelihood of a longer stay-at-home lockdown, the likelihood of even more enforcement activity, the likelihood of additional rules is all in the hands of every Victorian who is living under these rules. And if we all play a part, then it'll be more likely than less likely that we can be past this sooner.
So I guess my question is actually not data in terms of people's mobility, people moving around. It was indicating that some of those postcodes aren't adhering. Would you send in more police?
No, I don't think that's exactly what the Chief Health Officer said. The data won't tell you necessarily a story about whether people are being compliant. It might relate to that, but it can relate to lots of other factors as well. For instance, you could have data in a given postcode that might, on just a raw look at the numbers, look particularly worse than the neighbouring postcode. It may simply be that there are half a dozen families, all of whom have got it, which could then skew your data to the point where it looks manifestly worse. So I think data's always important. The science is absolutely important. But then having a granular understanding of each of those cases, each of those households, each local area becomes really important as well. I want to see these statewide, I want to see these metro-wide and Mitchell Shire restrictions work. If we get a sense, and if the data continues to tell us for whatever reason, and this is not about a commentary on compliance or otherwise, I'll make a point about that in a moment. If the data shows that the strategy is not being as effective as quickly as we would like, then we may have to go to new rules. The best and most important contribution that every Melburnian, every Victorian can make towards that not happening, make that less likely, is to follow the rules and please come forward and get tested if you are ill. The vast majority of Victorians are doing the right thing. There are others who seem to be spending inordinate amounts of time trying to find loopholes, trying to navigate their way through a set of rules. The rules are to protect you. The rules are to serve all of us. And I just say, if you've got that question in your mind, should I be doing this? The answer almost certainly is no, you should not. And through an abundance of caution and through the sense that all of us benefit from this strategy working, so all of us have to contribute to it, please, daily exercise, that's fine. A day trip where you're literally travelling 200 kilometres, no, that is not fine. It's just not fine. You can't do that. I know that's frustrating, but that's the reality that we face. And pretending it's over because we want it to be over, that is not a strategy at all.
There are some people who are genuinely trying to do the right thing. But
Yep. And I continue to thank them as often as I can, because it's making a massive difference.
So, and they're still confused, and they want to do the right thing, but they're not really sure of when they're allowed to go. Is there?
But are they though? I think a lot of people, if they pause and as the vast majority of people are, if you pause and use common sense, then you normally find the answer. Do I really need to do this?
So even
Do I?
playing golf, but most people don't have a golf course in a suburb, but
Indeed.
it's allowed. So are you allowed to go to a golf course
Well,
suburbs away?
Well, if you're a member of a golf club, then obviously that membership is a relevant factor, just like a tennis club or a lawn bowls club. If they're open in wherever you would normally, or fishing or shooting, whatever it might be, these are lawful activities. They are allowed under the Chief Health Officer's rulings, orders, but at the same time, we have to retain a sense of confidence that people are doing the right thing, and all the reports back in all of those settings is people are distancing. There's a whole range of different steps that have been put in place. I suppose the point you make is a good one. There's not a golf course in every suburb, so therefore you can't play golf in every suburb. If you're a member of a club, then it's not unreasonable to travel to that club. The notion, though, that the only place you can walk is 100 kilometres away from your home, that doesn't stand any test of logic. If you can go for a walk in your local community, back to the point I made before, daily exercise and a day trip are two very different things, and I think Victorians know that, and that's why the vast majority of Victorians aren't going on 200 kilometre round trips to have a walk at the beach. They're doing different things, and I'm very grateful to them. we'll always try and provide clarity and advice, but whenever you draw a line or make a rule, there will always be some grey area. What I'm asking Victorians to do is err on the side of caution, err on the side of not pushing the rules so that you can do something that's much closer to normal than COVID normal. That's the best way I can put it. If there are individual issues that need to be adjudicated, then of course we'd always try and do that, and we try and be fair about that. It's really hard to write a comprehensive rule book for human behaviour. The best thing though, err on the side of caution. If you don't have to do it, then don't. If you can do it locally, please do it locally. And daily exercise is not the same thing as a day trip, where you are literally travelling from one side of Melbourne to the other, many kilometres away from your home. When you could do that activity, you could be engaged in that activity in your local postcode or close by. Again, if I was to go for a walk, then I'd go for a walk in Mulgrave, where I live. I wouldn't be going to the Tan. I wouldn't be going to the far northern suburbs. I wouldn't be going to the coast. I would not be doing that, because I don't need to do that. I can get that daily exercise at home. A stay-at-home order is just that, stay at home. And thank you to all those who are. It's making a big difference. Let's all just try and use as much common sense as we can.
The Ombudsman Deborah Glass has announced an inquiry into the response to this particular Alfred Street, and said she'll probably investigate the response to the other towers when they went into hard lockdown. What's your response?
It's entirely a matter for her. I'm not focused on the work that the Ombudsman's doing. I'm focused on protecting people in those towers, and that's exactly what we've done. We have followed advice of the Chief Health Officer. We're providing a very large number of people are working day and night to provide support and care to those tower residents and other public housing residents, whether they be in those 9 original towers or others. That's our exclusive focus. The Ombudsman, of course, has functions and a job to do, and I'll let her do that.
There's not more military arriving this afternoon.
How many people, sorry, just further on Alfred Street, because
Yes.
I think it's Sunday that hard lockdown expires, or that 9 days
Yep.
that we talked about.
Yes, the balance of the 14, yep.
Yes, that's correct. So what's the likelihood that they will come out of hard lockdown?
I think the advice of the Chief Health Officer is that hard lockdown can end, but for anyone who still has symptoms, for anybody who has tested positive within the balance of that time and have further days to spend within their own unit, then they will need to do that, and there will be a proper enforcement process, just as there is with every other residence right across the state. What the balance that we've tried to strike here is to treat people no different, regardless of their landlord, regardless of their postcode, or whether they're in a tower or in a suburban house. But at the same time, recognise that there are unique needs in those settings and try and meet those needs as best we possibly can. And look, when you're doing something for the very first time, we've never done this before, there were some challenges in that first 12, 24-hour period, but everybody at all times has done their absolute best. That's all I can ask of emergency services, that's all I can ask of public servants, that's all I can ask of anyone, of the thousands and thousands of people that are part of the team. I'm confident that's what they've done, and they'll continue to do that. Their very, very best to support those who need it. Military arriving today.
Yes, more military arriving today.
Yes, Lundy?
The number of police who are now having to self-quarantine, are you expecting to need more military help to, I guess, supplement the work that not just paramedics are doing, but police as well?
Well, part of the arrangement that the Prime Minister and I have is that if we need further support, then I'll ask for it, and the answer will be yes. And that's exactly as it should be. I've got no advice that that's needed now. And indeed, I think as we mentioned yesterday or the day before, Lundy, more ADF arriving, as well as more Ambulance Victoria paramedics joining the public health team, some corporate staff from some of our largest employers. That'll be a feature of each day for the foreseeable future. So I suppose we're focused on standing up those commitments that have been made, that partnership that we've already announced. If we have to add to that, though, there'll be not a moment's doubt. No one will hesitate to make sure that we've got exactly what we need. That's been a feature of our response right throughout.
Temporary morgues being set up in hospitals to deal with the influx of patients.
Not that I'm aware of, no.
Just on international public housing towers have actually been moved to temporary accommodation. We're hearing reports of people in those towers wanting to go and requesting to go, but it can't be
No, I would say to you that quite the opposite is the feedback that I've got. I'm happy to get an update for you because it does change every day, but I think there's been far more offers of relocation that people have said, no, we would prefer to isolate in place. We're trying to be as respectful as we can of people's wishes. There's a whole range of different factors at play there. I'd not heard, but again, I'm happy to follow it up for you, but I'd certainly not heard the notion of people wanting to go and not being able to. We've gone to quite extraordinary lengths, family by family, using some community leaders as well, because there's a whole range of other factors at play. I think it's quite the opposite, but I'm more than happy to come back and try and get some numbers for you. It's a significant number, but it's far less than the total number of people who would have been eligible to go. Many people have exercised the choice to isolate in their own home, and I think that's an important choice, provided that we've got a high degree of confidence that they will in fact stay away from other people, and that's the experience.
Last question, please. Just on international flight, that 14-day period of the going away from Melbourne is up today. What's happening on that front?
No, I think that might have expired a couple of days ago, but in the interim, let's not quibble about the dates. In the interim, I have written to the Prime Minister. I think I made these announcements when I spoke about additional ADF support, indicating to him that there'll be no further international flights coming to Victoria for the foreseeable future. When you've got this much contact tracing to do, this much testing, when you've got all this work that we have to be focused on exclusively right now, that should be the centre of our focus, and it is.
And given that you have one case in hotel quarantine today, I think hotel
Correct.
quarantine was due to end today.
There's very few left. There'll be, for instance, Lundy, there's a few crew. So when we have freight that's flown in, there'll be ones, like small numbers. I can try and get you an update, but it's very, very small numbers now, because we've not had any of those large passenger arrivals, but there will from time to time. In fact, almost every day actually, there'll be a small number of crew who would be quarantined for, say, 24 hours before they then get on another plane to head back doing their important work. But it is down now to a very small number.
Are those crew being kept in the hotel, or are they? My understanding is some crew, like Emirates and Etihad, have been allowed to leave the hotels while they're here on their layovers.
I'd need to come back to you on that, but they're obviously in a different category when it comes to other return travellers, but their risk to public health is not taken any less seriously. But I'm more than happy to come back to you on that.
Has the full transfer to Corrections Victoria gone ahead? Have the Sydney Yard still working?
I'd have to come back to you on the detailed numbers, but you've got Corrections Victoria running the entire show, and that does give us some additional capacity. Further to Bridget's question in relation to those who are not returned travellers but might need to isolate, where there needs to be some sense of, well, it's not a custodial environment, but some sense of order to that environment. As you've got less and less returned travellers, that does give you some extra supervised, structured hotel space that you can use for whatever purpose you need to.
Professor Sutton, I may have missed it on your run through, but just with the last remaining tower, what are the numbers there? Have they stabilised, and so where are we at with the infection numbers in that last tower before Sunday release?
Yeah, I haven't got the exact number here today, but the Alfred Street Tower obviously went through that 11-day quarantine testing program. So I think there are 20 additional cases that have been identified through that. Again, not entirely unexpected amongst the hundreds who've been tested. Yeah, so that have come through in recent days to bring the number to around 70. So that's it's a big number in the scheme of things. But again, I think it's been people having been exposed in the quarantine period that have turned up as positive as we've gone through that day 11 testing for everyone in quarantine.
Can I just ask one genomic sequencing? Obviously, you released the first lot of data, and you're not releasing the second or the most recent lot. Who's made that decision not to release that?
So there hasn't been a release of data at all. I shared it with the Premier, and the Premier spoke to it in terms of the announcement of the judicial inquiry.
You did say yesterday you wouldn't be releasing. You made the decision not to release it because of the inquiry that's going on. Who's made that decision?
So I think I clarified yesterday, it's not my data. I haven't produced it, and it belongs to Peter Doherty Institute, who's generated it.
Unfortunately, they're saying they can't release the data because of that inquiry.
Yeah, their judgment, and I think it's not an unfair one, understanding that the inquiry is about to kick off and that it'll all be looked into very shortly.
We're seeing in New South Wales
people can become infectious very shortly after being exposed, right up until the 14-day period. But I think the particular circumstances in New South Wales related to a very infectious individual who passed it on to a number of other people. And because of that infectious dose that they received, they've developed symptoms very quickly. So it really relates to the specifics of that outbreak in New South Wales. We'll have cases like that in Victoria, but it's all within the spectrum of what to expect.
Are you able to tell us how many aged care residents have died in the second wave?
I don't know, sorry, in terms of the total number, but we can get back to you.
Will we get
Yeah.
that information?
Just a last question, please. Just a quick question on New South Wales Premier.
Sure.
There's quite an inflammatory front page in the Daily Telegraph saying dam-made disaster. Suggesting
I've barely got time to read the Melbourne newspapers, let alone to be worried about the ones in Sydney. And that's my answer to that question. And if headlines were an effective defence to this virus, well, that'd be great. That's not the circumstances we face. We've all got to follow the rules. That's why, perhaps if I can end on this, if there's no other questions, I want to thank every Victorian who is doing the right thing. It's making a massive difference. To those who aren't, please moderate your behaviour for whatever motivation you want to choose, whether it be your safety, the safety of your family, the safety of the community, or getting out of lockdown faster. I'm not too fussed what motivates you. Please do the right thing. Please moderate some of the behaviour that you've been exhibiting. If you've got any symptoms, please come forward and get tested. Can I thank the thousands and thousands of staff, who are working every day and every night doing the very best they can. If we want to thank them properly though, let's all follow the rules this weekend. Let's acknowledge that it's not a normal weekend. This is not a normal winter. This is not a normal year. If it's not bushfires, then it's this pandemic. We've been thrown a lot of challenges this year. But as a community, we're equal to them. If we look out for each other, if we make smart judgments, good choices, if we just use common sense, if you can do it locally, please do it locally. If you're in two minds about whether you should do something, chances are you shouldn't. To all those who are doing the right thing, thank you so much. To all of those who aren't, please, for whatever reason, please do the right thing this weekend. It will make a big difference. To thank our nurses, our doctors, our AMBOs, to thank the thousands of people who are working hard day and night. Let's all do the right thing this weekend, because that'll get us closer to the end of this really frustrating and challenging period. It will, as a strategy, work, but only if everybody who benefits from the strategy invests in it and is part of it. If there's no other issues, you can ask me if you want.
Oh, okay. Is there a chance that all elective surgery will be cancelled a coming days, given that we've seen big numbers, and is IVF included in the cancellation of category 3 elective surgery?
A couple of points. In terms, we made announcements about elective surgery yesterday. We're not proposing to change those arrangements. We do know that'll be deeply frustrating for a number of particularly category 3 patients, and we apologise to them for the inconvenience. It's about safety. It's about preserving hospital capacity. In terms of IVF, again, these are not matters for the government. They're matters for private clinics, but I can appreciate just how challenging, how frustrating and how disappointing it would be. But they are judgments that are made by IVF clinics. They've got a whole range of decisions they have to make. They're not easy choices to make. Our heart goes out to anyone who is mid-cycle or in the midst of that process. That's a really challenging. We hope that any disruption can be minimised, but that's not so much a function of decisions that the Chief Health Officer's made. They're judgments that are made by individual IVF clinics, and I'm sure that they're doing everything they can in the best interests of their patients. But again, there's lots of impact in lots of different ways. We don't anticipate any further changes to elective surgery at this time. That could change though. If it does, then we'll update people as quickly as we possibly can.
Sorry, I'll close. Have you asked the Minister something about the labelling clause?
Sure.
So will you support the proposed changes when Health Minister's next day, and will you be attending the meeting?
Well, firstly, can I say that we acknowledge the real harm to babies of drinking whilst you're pregnant. We have received and considered the expert health advice produced by FSANS, and Victoria will be supporting more effective liquor labelling. As soon as I'm done here, that's my intention. Thank you. Thank you.
See you tomorrow.